Hi, everyone. Welcome to today's session on strategic text messaging to support underserved patient communities during COVID-19. We're going to give folks a couple minutes to join, and then we will get started. All right, well, we will go ahead and kick things off for today's session. Thank you so much for joining us for our session on strategic text messaging to support underserved patient communities during COVID-19. Today, we're just going to be talking about a few different things. First, just introducing CareMessage and a little bit about our CMLight solution that we've been providing for safety net organizations, specifically during COVID-19. Doing a brief walkthrough of that solution, and then we'll be hearing from Amanda Osborne at ReGenesis Health Care. We'll be sharing some exciting results and data and impact that she's seen over the last few months, and then we will save some time at the end for a brief Q&A. So feel free to submit any questions you have either through the chat or through the Q&A button at the bottom of your screen that you'll see, and we'll be taking those questions at the very end. So feel free to chat those throughout the presentation. And now I will go ahead and hand things off to Christine Chang.
Thanks, Jess, and hi, everyone. Good afternoon. My name is Christine Chang, and I'm the Strategic Partnerships Manager here at CareMessage. Thanks for the great introduction to today's webinar, Jess, and we'll dive right in. CareMessage, we are a nonprofit 501c3 organization building healthcare technology specifically for patient engagement. We were founded in 2012 as the first and only patient engagement platform built exclusively for safety net organizations and underserved populations. Since then, we are proud to work with over 300 safety net organizations across 40 states. And since March of 2020, our organization has helped send over 20 million COVID-19 related text messages. We are extremely proud to have partners in both North Carolina and South Carolina. Of course, we'll hear from Amanda today, but in addition to ReGenesis, we are proud to work with organizations like Care South Carolina, Carolina Family Health Center, St. Luke's Free Medical Clinic, and Camino Community Center, and many others. In March of 2020, CareMessage released our free version of our platform called CMLight, specifically to enable health centers and safety net providers reach their patients with critical and regular communication in response to COVID-19. And as a follow-up initiative to creating the free version of our platform, CareMessage also launched what we call Project Equity, which is a concerted focus to reach safety net providers serving patient populations who are and were and continue to be disproportionately affected by COVID-19. This includes patient populations who are Black or African American, Latinx, Native American, Alaska Native, as well as rural and migrant communities across the U.S. Our CMLight solution focuses on addressing some of the most critical messaging needs and communication needs that we know our safety net partners face in response to COVID-19, and focus on one of two types of communication or functionality. The first is what we call group outreach, which is the ability to send a single message out to hundreds or thousands of patients. We have seen our partners, and we'll go through many examples in today's conversation about how our health center partners are using group outreach to send regular updates, both related to clinical needs as well as non-clinical needs to their entire patient population or cohorts of patients, as well as the ability to send one-to-one messaging through direct messenger, which is any kind of conversation, one-to-one messaging needs that a health center might have with a specific patient. CMLight was intentionally designed as an unintegrated solution with the EHR or the pop health solution because we wanted to give safety net providers the ability to get up and running and onboarded onto the platform within a matter of days or even hours of receiving their login. As such, we use a file center upload process to add patients to the platform, and we'll walk through that user workflow today to give you a sense of what it feels like to get started with the platform and just how easy it is to begin sending messages out to your patients. As a nonprofit focused on underserved populations, we know that when we work with safety net organizations, it's not enough to just have the functionality in the platform to help you all send messages out, but to also empower and equip our partners with meaningful content. And so we created a message library, which is free and publicly accessible to any safety net provider today. You don't need to use CMLight or our full platform to have access to this library, and we'll be sharing the link to this library at the end of the presentation. And our COVID-19 specific message library includes various use cases in response to the requests that our partners sent to us and the messaging needs, whether it's to address topics like hand hygiene, reinforcing social distancing, testing availability, the importance of wearing a mask, as well as providing social and emotional support to your patients via text message, and of course, addressing social determinants of health. We've seen, of course, and you all have likely partnered with many community-based organizations who are supporting your patients with access to food or housing support. And so we've seen CMLight specifically used to communicate those resources out to populations today. We also created telehealth tutorial videos. Though CareMessage were not a telehealth platform, we know and we heard from our partners that they wanted to use text messaging specifically to bridge the technology gap as health centers were quickly adopting free solutions like Zoom or Doxy.me for telehealth visits. And so we created recorded videos in both English and culturally relevant Spanish to help bridge that technology gap for instructions on how to actually use those solutions and the ability for our partners to send out the links to those videos via text message. I made mention of the content being recorded in culturally relevant Spanish, and I should add that all of our messaging and all of our library and content is written at a 6th grade reading level or below and offered in English and culturally relevant Spanish translations. Of course, with CMLight, as well as our full platform, you always have the option to create your own content should you choose to do that as well. Last, I'll touch upon CMLight and the ability to use this platform, which is completely free for any safety net provider. This is made possible by the generous philanthropic support of our donors like Johnson & Johnson, who have enabled us to offer CMLight for a minimum of 60 days to any safety net provider in the US. And I want to be really clear that there's no long-term commitment or obligation for a health center to purchase our full platform after using our platform for 60 days. To share a few more examples of how our partners are using CMLight today, I wanted to highlight actually on the examples that you see in the screenshots here. We know that as many health centers have reopened their doors, are now taking non-emergency visits, that they want to reiterate to their patient population that it's safe to come into the health center, that precautionary measures are being taken to ensure that they can have a comfortable and safe visit when they do come in, and that it's important to come in should you be overdue for a screening or overdue for a necessary visit. And so the 4 examples of messaging that you see here are ones that our partners have actually sent. They are anonymized, of course. And so you see that our partners are able to use messaging to provide that reassurance, to provide resources such as a phone line to call, as well as access and communication around some of the community-based organizations and efforts around social determinants of health that health centers have made to provide, for example, on the example on the left, free drive-through fruit and veggie pickup, and being able to collect the level of interest that their population might have by making that a bidirectional message. We'll go a lot more into how we actually set this up so that CareMessage and CMLight specifically can scale your ability to survey your patients without being overwhelmed by the responses that might come back in. Another great example, and made mention of the importance of telehealth during this time. This is another example we saw from our partners and really reinforces the power of bidirectional messaging through structured responses such that you can ask your patient population, are you open to telehealth? If so, what methods do you prefer? A voice phone call or video calling or either, and being able to then subsequently provide an automated response based off of the preference that a patient texts. So you'll see that with responses B and C, we're actually providing links to perhaps that telehealth tutorial video or other online resources, given that the patient has identified that they do have access to a computer or have access to internet, for example. With that, I will go into the CMLight presentation of the user workflows. And I'll provide a brief walkthrough of how our partners are getting started with CMLight today, how they're sending out group outreaches, how they're doing one-to-one patient follow-up. And then we'll hear from Amanda on how ReGenesis specifically has been able to do this successfully. As I've logged into the CareMessage platform, I do want to mention this is a demo environment, and so all the information you see here is fake. And on the left-hand side, most importantly, you see the different navigation through our platform. I made mention of the file center, which is how every single one of our CMLight users gets started with the platform. And through the file center process, health centers have the ability to upload a patient file with the button here in the top right-hand corner, and they're able to get lists from other technologies such as their EHR or their population health management solution. Through the file center upload process, you can add patients into CareMessage with their contact information, language preferences, and we'll even have the option to create groups based off of the patients within that file. And so the power of groups is eliminating that additional step that you might need to take to create specific cohorts based off of messaging needs, so that the content you send is far more relevant to the different cohorts you might want to reach. And you'll always have the ability to review your patients in total under the Patients tab here in CareMessage. Once you've uploaded all of the patients you want to reach into the platform, you can begin setting up outreach campaigns. And so I've navigated over here to our outreach dashboard, and right off the bat, you'll see an example of what this might look like for your organization after you've sent a variety of different messages and the historical messages that you've sent, how many patients you've reached, for example, being able to see messages and campaigns that are active today. And when I click to create an outreach, you'll see that I'm prompted to first add and select who I want to reach. So I have the opportunity to perhaps reach out to a group that I created through the file center process, or I can take that additional step here to filter based off the demographic data I might have uploaded in that file to select the patients I want to reach. And I'll go ahead and just grab 2, for example, here. And from there, I can select the template that I want to reach our patients with. I can copy and paste directly from the free message library, or to use one of the preloaded templates if it's the right message that I want to send to these two patients. And then finally, I'll select a date and time. We talked a little bit about the importance of being able to scale bidirectional messaging, and so I'll make mention of it here that though this is an example of a message that we're sending that doesn't require a response, should we want to set up a multiple choice question or a yes or no question, CareMessage will of course support that and give us the opportunity to customize the messaging and the experience that our patients will have depending on how they respond to the question that we're asking. We'll go into an actual example of what we sent, just to give you a sense of what this looks like as a campaign is ongoing or upon completion. And so you'll notice here, for example, we have a summary of the message we sent, who we've reached, the patient retention, response rates overall, and then of course the ability to click into the actual campaign, see who we reached, see which patients were responding, and potentially filter based off of patient response. Now, in a sample set of 34 patients, it's not too hard to look through and review each patient response, but when you're messaging hundreds or thousands of patients, you'll want that ability to filter based off of the multiple choice or yes, no response, and potentially even identify if patients reply with something different or unrecognized. CareMessage will automatically flag those responses so that your organization can review and make sure that there's not additional follow-up that you need to do with that patient. And if you do, you can go over to Direct Messenger, our one-to-one messaging feature, and begin a conversation with that patient. In this example of the Messenger dashboard here, you can see all the different patients we're communicating with right now, outstanding messages that I haven't yet received, as well as the historical conversation for any additional context I might need. Messenger has been incredibly powerful in response to COVID-19 because of the ability to have care coordination and care management. And I know that Amanda will talk a little bit about what that one-to-one communication has been like for her organization and how they've leveraged that. So with that, I'd love to hand things over to Amanda. I'll bring us back to our presentation. And Amanda, feel free to unmute yourself as I pull open the presentation.
Thank you. Good afternoon, everybody. Thank you for joining us. I'm excited to share with you our particular success with this product, just because an FQHC is hard enough. So if we can have a product that helps us move the dial to where we need to be, all the better. So we're based out of South Carolina, upstate, and we cover 3 counties. We've got 6 branches, and I am the quality manager, so I oversee our UDS measures. I work directly with our Pop Health team that oversees HEDIS measures, which drives STARS ratings with our insurance companies. We look a lot at quality and ECQM, so that's primarily been my experience in use of CareMessage. So this slide just shows our EMR is eClinicalWorks, ECW. And I'm not sure what PHN stands for, but we use Azera for a data repository. They pull all of our data from our EMR and present it in very pretty, easy to read and easy to use platform that I use that to drive CareMessage results. So I'll go ahead and go to the next slide. Thank you. So we have a few things that we really liked CareMessage about. One of the primary is that ECW does have patient appointment reminders that it sends out the day prior. However, we're only able to customize it based on one template, one verbiage for every single appointment, regardless of type of appointment. CareMessage is allowing us to customize our appointment reminders. So we may ask a patient who is new to come in 20 minutes early to fill out all of their paperwork, whereas an established patient only needs to come in 5 minutes early to verify their demographics. We will be able to customize that with the CareMessage platform. Ultimately, we wanted to look at the cost associated with this product versus what we already had in place. Implementation is a costly process to begin with. So what was our bottom line on this? After using this free platform, the CareMessage Lite, for about 2 months, we were able to get a sense that when we were talking with patients about scheduling appointments, on average, it took about 10 text messages just back and forth. That could be a lot less, it could be a lot more, it just depends on the patient. With the CareMessage package, they were not, on the CareMessage Lite and on the big package, they're not charging us based on text messages sent, they're charging us based on patient volume. So to break even, I need to send 6 to 7 text messages through CareMessage to compare that cost to ECW. So one other thing about ECW is using their text message, it just isn't very user friendly. You get no notification that a patient has responded. Even using their platform to, their portal to go into is quite challenging. So CareMessage was a nice way to have that in one easy spot, not having to bounce all over an EMR to get what we needed. Then when we say learning from conducting text campaigns, we started off with a pretty basic approach, just saying, hey, we show that you are due for your annual PAP or your annual mammogram, something along those lines, and we'd like to get you scheduled. Would you like us to give you a call to help you schedule? And the patient would respond yes or no. That was fine and dandy. We'd immediately pick up the phone and call them, and if they didn't answer, we would send a text message with a standard text directly to the patient using the text to patient feature, just saying, hey, we're trying to get in touch with you to get this scheduled. What day or time or location works for you? Having that conversation there. But we learned that if we give the patient the freedom to determine how that conversation actually unfolds and is facilitated, they were a lot more engaged. So instead of saying, do you want us to help you schedule, we would say, reply A, to have someone from the office call you, reply B, to have someone from the office text you, reply C, for a reminder in 1 month, and reply D to decline. We're getting about a 20% response, which is pretty high when you're looking at 900 women who need a mammogram or a cervical cancer screening. Another thing that we learned is to do it in batches. Don't take all 900 people that need the screening and throw out a text message all at once, because patients are responsive. You're going to lose your conversion rate if the more time that goes from the time that they reply saying, yes, help me get scheduled. If it takes you 2 or 3 days to get to that person because you've gotten so many responses, your conversion rate's also going to drop. So we learned to do it in batches. If there was one person working on a project, we would text up to 20 women, wait a couple of hours, text the next 20 women, and you can schedule the system to automatically send out those texts in a couple of hours so that you're not having to babysit it. If 2 people were working on it, we might bump that up to 30, but we were definitely trying to keep it as manageable as possible without disappointing our patients with regards to the time it took to follow up with them. Next slide. So with our lessons learned and just with our use of Azara, our EMR, and CareMessage, we had some pretty phenomenal rates. Now this slide says 170 women were scheduled for cervical cancer screenings. That actually went up to about 210 because I connected one of our providers who had a very low volume with a report of their women needing breast or cervical cancer screening, and I got them set up on CareMessage, and they packed 2 days full. So we actually got about 210 women scheduled because of CareMessage in conjunction with Azara. We did increase our breast cancer screening rate significantly, and our cervical cancer screening rate went up by 8% in 2 months. We've now increased that, since that number was provided, up to 11%. So pretty significant shifts. We wanted to get our provider buy-in and have them also use CareMessage if possible. So one way I did that was just setting up women's health days, getting these women on the schedule, and telling the providers I was able to get these people scheduled by using CareMessage and Azara. And once they saw their numbers jump, and as you see in the very bottom bullet point, one of those providers had significant jumps in their screening rates, 18% for cervical cancer, 11% for breast, and 13% for colorectal cancer. And that was in 1 month after one Women's Health Day. She obviously is super excited, and there's a bit of friendly competition between other providers now, and people want access to the tools that are driving those rates. So I've got 3 providers out of 17 using CareMessage as well. And of course, now they're using it for other things such as checking in on their mental health patients, or just saying, hey, you didn't schedule your follow-up for 1 week. I need to see you. Can you please get that scheduled? So they're now using it as well to engage with patients. The what's next. So reducing no-show rates through text-based appointment reminders. That again, it has a lot to do with being able to tailor your appointment reminders and engage patients in a meaningful manner. Like I said, we've had better preventative outreach, and the direct two-way texting is highly effective for us. Improving patient education, quality of patient care, and patient experience. There are so many people who have responded back saying, I didn't know our doctor's office did this. That's really convenient, thank you. Just meaningful experiences and interchanges with our patients has been very happy. Patients are very happy with it. And the automated patient satisfaction surveys, I'd have to turn that back over on that, because we actually don't use that to my knowledge. So Christine, I'll turn that point over to you.
Great. Thank you so much, Amanda, for sharing the examples, and as well as some of the improvements made to the screening rates. We'll be sure to update on this as you all are actively continuing to use CMLight and implementing the full platform. So thank you so much for the incredible storytelling here and the work that you all have done. And we're so proud to have been a part of it and to be able to support the work that you're doing. I'll conclude today's presentation portion of the webinar with sharing some of the resources for organizations who are interested in using CMLight. You can, of course, go to our website to reach out, and we'll be in touch with your team. We also, of course, have the free resources that are public and accessible to any safety net provider, and the links included there to the message library, as well as the telehealth videos are listed below. And really want to emphasize that with CMLight specifically, our goal and our mission as a nonprofit organization is to share this as widely as possible with safety net providers across the U.S. to support their patients during this time. So with that, thank you everyone for joining us, and we'll go ahead and we'll open up to Q&A. Please feel free to use the chat in Zoom or the Q&A functionality to submit a question for myself or Amanda. And as folks are submitting their questions, just a friendly reminder that we will be sharing the recording of today's webinar as well as the deck via email so that you all can share this with your peers. One question that we've received asks, how challenging is it to implement CMLight, and how do we do that with our existing EMR? And it's a great question and want to address that because CMLight is intentionally designed as a solution that isn't integrated with the EMR because we wanted to give access to the platform as quickly as possible to health centers, knowing that the communication needs, specifically in response to COVID-19, typically are more urgent. So with CMLight, it only takes a matter of really hours, but typically days to get started with the platform. And as soon as you've received your login access, you can begin uploading your patient lists and information into the platform and begin sending messages, really within a matter of hours of doing that. We'll give folks just one more minute to submit any questions that they might have for myself or Amanda, and otherwise we'll be able to wrap. Oh, we received one question. How much does the platform cost? And to clarify again, CMLight, that platform for COVID-19 messaging, is a completely free solution, and there's no long-term obligation or commitment that we ask our health centers to purchase the full platform after using CMLight. So I want to be very, very clear about that. Our full platform pricing is based off of the health center's total patient population and intentionally designed as an annual subscription model to provide and offer transparency and predictability around the investment in your patient engagement solution. As Amanda had shared, unlike other solutions that might charge per provider or per text message, we want to enable as much engagement as needed to drive meaningful connections with your patients, and as such, believe in an annual subscription model to support those efforts. So happy to follow up with the organization that is asking today to discuss the use of CMLight or the full platform with you after today's webinar. And with that, we'll go ahead and wrap today's webinar. Thank you again, Amanda, for joining us for today's presentation, for sharing the incredible work that you all have accomplished at ReGenesis and what's to come next for your organization. We are wishing you the best, and especially thinking about our partners and organizations in South Carolina, in North Carolina during this time. And we look forward to hearing from you all in the future. Thank you again, and have a great rest of your day.
Thanks, Christine.